Take a deep breath. It's the thing that gives us life, and you won't take it for granted after you see this story. Patients with lung failure are so short of breath, even a short walk to the mailbox is impossible. For many of those patients, a lung transplant is their only hope. Fortunately, there have been vast improvements to this very complicated surgery in recent years, but still, there have been very few lung transplants in this area, despite a growing demand for them. One Mid-South doctor wants to change that. In this month's cover story, Rod Starnes has a breath of fresh air for those who need lung transplants.
Bill Hall has a new lease on life.
It's an awesome feeling. Just an awesome feeling.
Like most grandparents, Bill cherishes the time he spends with his grandchildren. But lung failure threatened to take away that joy.
Your quality of life is totally restricted. You can't play with your grandkids. You can't just do the simple things that you just take for granted. You took for granted for years.
After smoking 2 packs of cigarettes a day for 15 years, Bill had developed a very aggressive form of emphysema.
I got more winded than normal, and went for some heart work. They sent me to a pulmonary doctor, and he said, "Your problem is pulmonary," and it went downhill from there.
Things got so bad, Bill couldn't even walk to his mailbox. His emphysema ultimately led to lung failure, and that meant being tethered to an oxygen canister at all times.
You start on a little slippery slope, and the next thing you know, the slope is turned into a cliff, and you just fall off the cliff. And that's what happened to me in February. Again, I went with double pneumonia. Things got really complicated.
That's when Bill went to Dr. Matthew Ninan with hopes of getting a lung transplant.
Hi, Mr. Hall. How are you doing?
Great. Met him and was just absolutely just thrown back. Amazing man. He said, we'll find you some lungs.
Essentially, lung transplantation is meant for people who have severe lung failure, meaning that they just cannot breathe anymore and all medical treatments have been exhausted.
There are few treatment options for patients with lung failure like Bill.
If the patient's kidney fails, for example, they can have dialysis. If the patient's heart fails, we even have newer machines that can keep the patient alive. But if the lungs we have a problem with, we really have nothing to go by. And so, working over the last 10 to 15 years and getting the mortality rate or the survival the same as most other organs, at least in the early period, has been a huge amount of work.
Dr. Ninan recently moved to the Mid-South to bring his expertise and a new focus on lung transplants to the area.
We are physicians that are specifically focused on surgery for lung problems. In this area of Tennessee, we have a lot of patients with lung failure. And traditionally, there have been a small number of transplants done here in Memphis, but most of our patients have gone out to great distances, to places like Pittsburgh and Minnesota even, to get transplanted. And so what we are trying to do is to create that environment right here.
Bill didn't want to travel far from home for a transplant because he knew he needed a healthy dose of family support to make it through the recovery process. That made Dr. Ninan's team a good fit for Bill. Dr. Ninan evaluated Bill and determined he was a good candidate for a double lung transplant. And then they waited for the donor lungs.
The phone rang at 5:15, and it was an easy transplant, and we have a couple of lungs for you. You see in 2 hours. And I woke my wife up, and we just absolutely just freaked out.
Bill headed to the hospital and into surgery even before the donor lungs had arrived.
We need to time everything from the time that they call us out for the organ. We need to time exactly when we are going to take the organ, how quickly we are going to get the patient on the table here, and everything has to work like clockwork. Once a donor is referred to us, we have to take the organ out quickly, and we have to bring it back quickly and implant it in the patient as quickly as possible. This is one of the more complex surgical procedures. The complexity of replacing the lungs is based on the fact that you have so many connections between the heart and the lungs.
In less than 7 hours, a short time for an elaborate process, Bill had new lungs thanks to Dr. Ninan's expertise.
We have changed our surgical techniques around so that the operation has become much smoother and much quicker.
And that made all the difference for Bill, who can now walk to the mailbox and beyond with his wife.
Now it's effortless. You know, you catch yourself, geez, am I really breathing? There's really no way to try to put into words what one feels like when all of a sudden life goes from glim to no life to just in front of you. You know, and not only will I see my grandkids grow up, I'll probably see them graduate from, if not high school, maybe even college.
While Bill says that he is high on life, he knows his recovery would not be possible without the sacrifice from the donor's family.
I am carrying someone they loved inside of me, and I want them to know that I'm going to take care of that person.
Take care.
To that end, Bill's medical team, who he now considers to be family, will be there with him every step of the way.
They've given me something. They've given my family back. They've given me a life. They've given me something I haven't had in a long time. That's summarized in one word: it's purpose. I've got purpose.
For Smart Medicine, I'm Rod Starnes.
Joining me now is Zola Burgess of the Mid-South Transplant Foundation. And Zola, thank you so much for joining us.
Thank you.
All right. How prevalent is the need for organ donors here in the Mid-South?
Very much so. Nationally, we have over 96,000 people on the waiting list. But in the Mid-South, for our different organs, we have approximately 484 just in our service area.
Why don't more people donate?
We truly believe that 85% of the people really want to donate, but they have not expressed their wishes to their family. And a lot of people are really stuck on the myths and misconception about organ donation. The number one myth would be that you're going to let me die to get my organ. That is so untrue, because we have doctors, trauma surgeons that will work on a person, and they do not let us know about a patient until after they have done everything possible to save that person's life.
So what should someone do if they want to become an organ donor?
True enough, when you go to the driver's license place to get your license, do sign the back of your driver's license. It is indeed an acknowledgement, but overall, your family needs a discussion.
So you need to share your wishes with your loved ones.
Share your wishes with your loved ones.
All right. Zola Burgess, thank you so much from the Mid-South Transplant Foundation.